Hello everyone. In this video I will let you know about mental health, information and knowledge and concept of mental health. First of all you have to go to Google and then write down mental health. Then go to World Health Organization's website. Click on it, then this website will appear. Concept in mental health. Mental health is a state of mental well-being that enable people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. It is an integral component of health and well-being that underpin our individuals and collective abilities to make decisions, build relationships, and shape the world we live in. Mental health is a basic human right and is a crucial to personal, community, and social economic development. Mental health is more than the absence of mental disorders. It exists on a complex continuum, which is experienced differently from one person to the next with varying degrees of difficulty and distress, and potentially very different social and clinical outcomes. Mental health conditions include mental disorders and psychosocial disabilities, as well as other mental states associated with significant distress, impairment in functioning, or risk of self harm. People with mental health conditions are more likely to experience a lower level of mental well being. But this is not always or necessarily the case. Determinants of mental health. Throughout our lives, multiple individual, social, and structural determinants may combine to protect or undermine our mental health and shift our position on the mental health continuum. Individual psychological and biological factors such as emotional skill, substance use, and genetics can make people more vulnerable to mental health problems. Exposure to unfavorable social, economic, geopolitical, and environmental circumstances, including poverty, violence, inequality, and environmental deprivation, also increases people's risk of experiencing mental health conditions. Risk can manifest themselves at all stages of life, but those that occur during developmentally sensitive periods, especially early childhood, are particularly detrimental. For example, harsh parenting and physical punishment is known to undermine child health, and bullying is a leading risk factor for mental health conditions. Protective factors similarly occurs throughout our lives and serves to strengthen resilience. They include our individual social and emotional skill and attributes, as well as positive social interaction, qualified education, decent work, safe neighborhood, and community cohesion, among others. Mental health risk and protective factors can be found in society at different scales. Local threats heighten risk for individuals, families, and communities. Global threats heighten risk for whole population and include economical downturns, disease outbreak, humanitarian emergencies, and forced displacement and the growing climate crisis. Each single risk and protective factors has only limited predictive strength. Most people do not develop a mental health condition despite exposure to a risk factor, and many people with no known risk factors still develop a mental health condition. Nonetheless, interacting determinants of mental health serves to enhance or undermine mental health. Mental health promotion and prevention. Mental promotion and prevention interventions work by identifying the individual, social, and structural determinants of mental health, and then intervening to reduce risk, build resilience, and establish supportive environment for mental health. Interventions can be designed for individuals, special group, or whole population. Reshaping the determinants of mental health often requires action beyond the mental health sector, and so promotion and prevention programs should involve the education, labor, justice, transport, environment, housing, and welfare sectors. The health sector can contribute significantly by embedding promotion and prevention efforts, initiate and where appropriate facilitating multi-sectoral collaboration and coordination. Suicide prevention is a global priority and included in the sustained developmental goal. Much progress can be achieved by the limiting access to means, responsible media reporting, social and emotional learning for adolescents, and early intervention. Banning highly hazardous pesticides is a particularly inexpensive and cost-effective intervention for reducing suicidal rates. There are mental health care and treatment centers also available where mental health services that are integrated in general health care, typically in general hospitals and through task sharing with non-specialist care providers in primary health care. Community mental health service, psychosocial services, services that deliver mental health care in social services and non-health settings, these are available. Thank you so much.